Good evening, everyone. Yes, I'm a veterinary pathologist like Alison that you had from earlier. I'm based at the Royal Veterinary College in London, and I want to speak about a common tumour that occurs in multiple of our veterinary species, but focusing on dogs and cats this evening. So next slide, please. So the tumour is called lymphoma. It also occurs in people. And it's a malignant tumor, so a cancer derived from lymphocytes, common in dogs and cats. And it can be quite a challenge for veterinary surgeons to diagnose lymphoma because the clinical signs, we speak about clinical signs in animals, that's equivalent to symptoms in people, can be very variable, but they often include weight loss and enlarged lymph nodes. So if you have a look at the dog on the top right, where the arrow is pointing just under the dog's jaw, is very swollen, and that's because there's an enlarged lymph node, which is packed, unfortunately, with these neoplastic lymphocytes. And as Alison explained in her talk about mouth cancer in cats, diagnosis of tumors in our animals would generally involve either aspiration, so removing via a syringe cells from the lesion, we call that cytology, or the collection of a tissue sample, which we call a biopsy. And a biopsy from the dog with the swollen lymph nodes is shown in the lower image. And what we're seeing there is a uniform population of immature lymphocytes, which we would interpret as being a cancer. The importance of this is that the response to chemotherapy for lymphoma is very variable in animals, both within dogs and between dogs and cats. So next slide, please. And as Alex was explaining in his talk, mentioned immunohistochemistry. So immunohistochemistry is the technique whereby cancer cells generally express proteins, which we call antigens, often on the surface of the cell, and we can use labeled antibodies to recognize those different proteins and thereby identify and subdivide different cancers. And in lymphoma, the key subdivision is we want to try and distinguish between lymphoma derived from B cells from lymphoma derived from T cells. And so the photograph on the right-hand side is a T cell lymphoma. And we've used antibodies to stain the cancerous, the neoplastic T cells, the brown color, and then the normal cells are the very pale blue beige color. The importance of that is that in dogs, B cell lymphomas generally respond better to chemotherapy than T cell lymphomas, so we can give the owner a more accurate prognosis, a more likely outcome for their animal. But something mentioned just at the end of that slide, which is, I think, a challenge for veterinary pathologists is, of course, we deal with multiple different species. And something that's quite noteworthy in this type of cancer, as in a number of others, is that the same tumor, so the same lymphoma in a dog versus a cat, can have quite a different outcome. And in cats, the response to chemotherapy relates more to the location where the tumor arose than to the type of lymphocyte that it arose from. So next slide, please. And so the reason I mentioned that is that increasingly in veterinary medicine, and a number of colleagues have mentioned this already this evening, we're interested, as in human medicine, to use more sophisticated molecular techniques to try and pinpoint specific genetic mutations in different cancers, which might enable us to personalize therapies to our animal patients. And there's an example of that in the image on the right-hand side. So those are chromosomes from a dog with lymphoma, and the different colors of the chromosomes indicate the either loss or gain of DNA due to the cancer, which gives us a very accurate fingerprint, if you like, of the mutations present in that tumor, which we hope within the veterinary pathology profession will enable us to target more specific treatments to the different genetic subtypes of this common disease.